this video is for entire wax evaluation, which means it's going to be brow, lip, underarm, full leg, and bikini. And so I will be starting my video as if I've just arrived to work. So the first thing that I'm going to do is I'm going to wash my hands. I'm going to go to the sink. I'm going to identify some liquid hand soap, get that coin size amount, wash my hands together down to my wrists. I'm going to wash the back of my hands down to my wrists. I'm going to wash my fingers, and I'm going to wash the backs of my fingers. I'm going to wash my fingertips and nails. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs. And I'm going to do all of this interlocking wash for a minimum of 20 to 30 seconds. When I feel like, ew, pardon me, I have fully cleansed my hands, I'm going to give them a good thorough proper rinse. And I'm going to grab some disposable paper towels, turn the faucet off, completely dry my hands off, toss the paper towels into the trash, and then I'm going to get my hand sanitizer that is 70% ethyl alcohol, and I am going to sanitize my hands thoroughly. And then I'm going to prepare my room for my client that's coming to get all of this waxing done. So what I want to do first, of course, is prepare my room. So we're going to talk about that. We're going to disinfect our workstation, bed, and equipment using a disinfectant wipe, following manufacturer's instructions. We're going to check all of our equipment to ensure that the devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. We're going to dispense products needed for the service. We're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with a disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. We'll close the lid to the product and set the portion cup tray on the tray. We'll place disposable table paper on the disinfected bed to ensure that the wax does not fall onto the bed. So we're going to talk about that for a second. So we are going to, I don't have table paper, so I'm going to fully dress my bed, and would recommend that anyway, considering she's having a bikini wax and a leg wax and all these other waxes. She's going to want some privacy, and you're going to need to cover her up. So forget the table paper and do the fitted sheet, the flat sheet, the blanket, the towel horizontal across the top of the bed. That would be my recommendation for all the waxing that she's having done. But I'm just going to review with you what I have here on my tray, so you'll know that how I have prepared for my clients. So I have 2x2s, cotton rounds, 4x4s. Of course, a pair of disposable gloves because we wear gloves for waxing. I've got water, pre-epilation, powder, remove step for the wax remove, and the soothe, the post-epilation. This is my wax, but I have turned on my wax pot. So you want to make sure at least 30 minutes prior to your client getting here, your wax pot is turned on. You would have done that in this prep step as well. I have all different sizes of wax strips, and I have all different sizes of sticks that would be applying wax because we're doing different kinds of waxing. So different sizes would make things better. You're not going to wax someone's leg with that, and you're not going to wax someone's lip hair with that. So just be mindful of that. I've got some wooden stick Q-tips. Of course, I have tweezers. I do have scissors here, and that's in case I need to cut any additional strips. So really, all of that part of the prep should be done before your client arrives, so you're not stopping to literally do what I'm doing right now. I'm just showing you an example of how awful and annoying that would be to have to stop waxing your client who is in pain to create some more strips. So before your client gets here, make sure that all your strips have been cut. So just giving you a heads up on that and how we've prepared beautifully for our client. And this is a new client, and she's getting a lot of waxing done. So we're going to talk about lots of different things with this video and talk through a lot of different things with this video than we normally do. We're going to go over a client consultation, and we're going to go over some more details of a client consultation than we have in some of the other videos, because we're waxing a lot of her body, and we're going to talk about important things to make sure that you discuss with your client to make sure that it's okay for her to have this service, or him, because a lot of men get waxed. So let's talk about our client consultation. Now, I will be meeting with my client with clean hands, of course, and I will be washing my hands again before I even start this service, after the client consultation, before I even start the service. So just so you know, I want to make sure we notate that. You're going to greet your client and escort them to the work area, assess the client's current style, determine the client's preferences, and assess the client's needs. We will assess the client's skin by performing a skin analysis. The only thing you can assess at this point is her face, or his face, because they're dressed. FYI. To ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on. So you cannot visually assess their legs if their legs are not exposed, etc. You'll talk about that in a minute. Or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. I'm going to go into detail on that in a minute. We will consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We're going to assess if the client is prone to cold sores or fever blisters. Important. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Important. We'll go over that in a minute. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from that, and let's go into more detail actually before we move forward on that. So we are going to talk about extra contraindications that's not on that form right there that we need to talk about. Some of those contraindications, such as certain moles and warts, will become apparent only after working with the client and closely surveying the skin. These conditions can be noted on the form at a later time or on your computer system, in your computer system for your client. But be sure not to wax over these areas to prevent causing irritation or spreading viruses or bacteria to other areas. Let's go over some skin conditions or contraindications that you need to be cautious of because you're working on legs, varicose veins, unusually pronounced moles or warts, cuts, abrasions, wounds, or open sores, active herpes. It can be on the mouth. That's the cold sore that we talked about around the mouth. We would not be waxing if that was present. Acne, so be careful with that. Skin diseases or disorders, sunburn, no waxing on the sunburn. Rashes, clearly we're not going to do that. Cysts or boils. If any of these conditions are present, do not perform the waxing service. It is important to be aware that herpes in particular is highly contagious and you should never perform a waxing service on a client who has an active outbreak. In addition, skin diseases that present visible irritation on the surface of the skin should never be waxed. The existence of the following health conditions may cause the client to bruise, swell, or experience excessive pain during a waxing service. In addition, conditions such as diabetes impair the healing process. So no waxing, diabetic, poor circulation, chemotherapy or radiation treatments, hopefully they're not trying to be waxed, high blood pressure, low pain threshold, or lupus. Many of the following medications, remember we were talking about what medications someone is currently on, can cause the skin to become thin, fragile, and dehydrated. Do not wax while a client is on Accutane or for about 3 months after the client ceases taking Accutane. Instruct clients to avoid use of retin A and alpha hydroxy acids for at least 48 hours prior to and after the service. So here's some topical medication treatment or oral that is a no-no. Accutane, we just said, antibiotics, cortisone creams, retin A, Renova, alpha hydroxy acids, beta hydroxy acids, which we also said on that form, and chemical peels. They can't be waxed. So just wanted to go into detail before you get into any more specifics that you would say, sorry, we can't do that today, and this is why, and this is what we recommend. Okay? So that would keep you ethical, professional, and you would not harm your client. That's the most important thing. So our client does not have any of those contraindications. Wow. So we can move forward with the service, and she's getting a lot of stuff done. So you would give her privacy for this because she is going to disrobe. She's also going to either bring a bathing suit bottom, or she's going to wear disposable undergarments that you will give her, provide her, that she will toss at the end of this service. So what we want to do is get her as comfortable as possible, and we're going to start with the brow and the lip and on the face, and then we'll work our way down underarm bikini legs. So, or you can do underarm leg bikini, whatever you want to do on that end. So what we're going to do here is we've given her some privacy, and she's in like a robe and her, a drape in her disposable undergarments. I have a roll towel that I've placed under her head. I have put a hairnet on her to keep her hair out of her face, eyebrow area, and lip area, so we can do that. For now, I'm going to go ahead and take